The maternal family of Olivia welcomed the findings of the coroner's inquest into her tragic and unnecessary death. The last 4 years have been the hardest and most difficult journey we could have embarked on. To lose our wonderful, vivacious and captivating girl in circumstances which we now know were avoidable. We have been fighting for the truth of what really happened since she passed, and the story we were presented with by the Ministry of Defence was very different to the conclusion that has now been reached by the coroner.
Well, let's cross live to Reading and our correspondent Alice Porter. And Alice, there we heard mention of that conclusion from the inquest. Tell us what that conclusion was.
Well, we heard in court today that Olivia Perks very much started her training at Sandhurst, very bubbly, incredibly hard-working. But it was very apparent quite early on that her mental health took a serious toll, and quite early on she made a suicide attempt early on into her training. Now, although the coroner applauded the attempts by the primary care team and how they dealt with it at the time, the coroner, Alison McCormick, also said the situation brought to light failings within the welfare system at Sandhurst, and crucially said that there was only one welfare officer for more than 2,500 people, and that welfare officer had no prior training. She said Liv's welfare was not managed in accordance with Army policy for vulnerable people. And I think that was one of the main messages which came through in the inquest today, was that there were safeguarding policies in place, but Alison McCormick criticised the Army for not doing enough to take these on and actually put them into practice when it came to Olivia. And this very much came to a head really in the year of her death in 2019, and it was in that February. And what was one of the most shocking aspects, I think, really that came through with this inquest was that despite relationships between cadets, those who are training, and members of staff being banned, Olivia Perks did have a relationship with a member of staff, and in the week leading up to her death, she spent the night with one of the colour sergeants, and it was rumours that were then circulating. She was incredibly embarrassed about the situation, and the coroner criticised the Army for not making a referral to the medical team when she started self-harming. She was banging her head, and sadly only a few days later she took her own life. Now, the Army have said how sorry they are for what has happened, and they did an internal inquiry last year into what happened. They made 61 recommendations, and they were heard in court previously, and the coroner said she very much hoped that Olivia's legacy will be very much that those recommendations that the Army found will be put into practice.